So he requires 24-hour supervision. And even when he's playing by himself, you have to be watching that he's not picking himself or hurting himself or trying to get something he shouldn't have and hide it. And he gets bored really easily and needs a lot of stimulation. So it's more than a full-time job for sure, 24/7.
Things get real hectic real quick, especially with my son and his own needs, and then my daughter and her own needs, and then you got a toddler added in into that. It becomes too much, overwhelming is what happens, and I really needed help. I really needed help.
Care coordination really is a family-centered, team-based approach to care that provides a more integrated way of caring for children and families who would be considered to have complex medical and social needs.
The idea of the care coordination is really to provide the glue that brings together all of the medical, social, therapeutic, and educational services, which is really a big challenge. And to help families learn how to navigate the system themselves.
There are challenges. There's the clinical work and answering the mental health and health-related questions, and sometimes the coordination between those two systems alone can be challenging for parents to navigate and for clinicians to understand. And then there's the navigation across the school system needs and then the government support system needs.
Care coordination really allows that family to maybe give up a few of those balls that are in the air for the time being, so that they can get back on track, that they can get more stable, so that they can then take all of that back on. But with the work that we've done, having connected them to resources and community supports, making communication better between care teams and schools, that it's easier for them to juggle all those balls. It's easier for them to cope and to move forward in a more positive way.
A common barrier to successful treatment and support for these children and their families is a persistent lack of coordination across pediatric service sectors. And we know that fragmented services negatively impact patient outcomes, but also family functioning and quality of life. And this often results in inappropriate and inefficient healthcare utilization.
You know, sometimes I'll know that there's an appointment coming for a family and be able to be there as a support for the parents, and share some of the information that's been happening in the spaces in between their last appointment with that family. So they can really focus on what the child's there for and know that some of those other stressors, other issues, other recommendations, the family's being supported with those.
Care coordination is that higher level strategy that we really need to be looking at with those families who are with us for the long haul. Because it is a life journey and things change over time, developmental stages, school, transitioning to adulthood when you're leaving pediatrics and launching into adult health services. Like, there's just so much along some people's journey that we have to stay patient and family-centered.
Typical crazy day for me would be waking up, completely forgetting that one of my children or myself has an appointment. Some of the appointments that you could possibly miss take ages to get back into. And I started finding myself missing, and my poor son, that's the last thing he needs.
The time required to try and meet all his needs, all those things are also part of his care and also part of our family life. And so for me, it's given me, again, permission to say, yeah, we're on track when we think for the whole child and the whole family, not just treating him as a child in each separate clinic with, an endocrine problem, a GI problem, a respiratory problem, but to see him as the whole child and the whole family.
The care coordination model is really designed to foster strength-based relationships with the family and the child, and emphasizes a collaborative working relationship across services and sectors.
It has taught many of those families how to navigate the system, because it's complicated and it's difficult and it's hard to remember, what do I send in for who? When do I have to have this? Who do I call for this? And so helping the ball rolling, it's not hand-holding, it's teaching them and then empowering them to go forward with that, both on an advocacy level, saying, this is what we need, but also in actually accessing those things.
I feel these families come back to me more empowered. They realize that they've learned some skills to advocate better for their children. So I think they're much more comfortable and confident to follow through on the suggestions. They are quite comfortable accessing the care coordinator. I've felt like all these families have really benefited and been quite happy with what they've received. And so I feel much more confident when I make a recommendation that they're going to follow through. And we are seeing actually better rates of actually showing up for appointments in our office, and that in itself is a testament.
It's sometimes towards the end of my involvement with the family, my role might be just to be sitting there and listening and realizing, okay, this family doesn't need me to come to appointments anymore, and that's always a huge success.